Hello, welcome to the breast cancer presentation. My name is Pamela Kevitch, and I am the Senior Health Promotion Specialist at SummaCare, and I will be your host. This presentation will explain breast cancer and review current statistics, as well as learn about the symptoms, risk factors, screenings, and treatments that are available. While all dimensions of wellness need our attention, there doesn't have to be balance among all of the dimensions at a given time. Instead, the goal is to find harmony with the dimensions that are most authentic for you. This presentation will focus on the physical domain by adopting healthy habits and avoiding or minimizing risky behaviors that are hazardous to our well-being. The most significant risk factors for breast cancer are being a female and growing older. About 1 in 8 U.S. females will develop invasive breast cancer over the course of her lifetime. The median age at the time of breast cancer diagnosis is 62 for females. A male's lifetime risk of breast cancer is about 1 in 833. In 2024, an estimated 310,000 plus new cases of breast cancer are expected to be diagnosed in females in the United States. 2,800 new cases are expected to be diagnosed in males. Just over 42,000 females in the United States are expected to die in 2024 from breast cancer. And about 85% of breast cancer occur in females who have no family history of breast cancer. Breast cancer is an uncontrolled growth of breast cells, and to better understand breast cancer, it helps to understand how cancer develops. Cancer occurs as a result of mutations or abnormal changes in the genes that are responsible for regulating the growth of cells and keeping them healthy. But over time, mutations can turn on certain genes and turn off others within a cell. That changed cell gains the ability to keep dividing without control, producing more cells just like it and forming a tumor. A tumor can be benign or malignant. Benign tumors are not considered cancerous. Their cells are close to normal in appearance, they grow slowly, and they do not invade nearby tissues or spread to other parts of the body. Malignant tumors are cancerous, and if left unchecked, malignant cells can eventually spread beyond the original tumor to other parts of the body. The term breast cancer refers to a malignant tumor that has developed from cells found in the breast. Usually, breast cancer either begins in the cells of the lobules, which are milk-producing glands, or the ducts, the passages that drain milk from the lobules to the nipple. According to the American Cancer Society, any of the following unusual changes in the breast may be a symptom of breast cancer. Changes in skin texture, such as scaliness or thickening. A nipple discharge other than breast milk. Skin dimpling. Lymph node changes, such as a lump in the underarm area or above the breast. Breast or nipple pain. A nipple turned inward. Redness or darkening of the nipple or breast skin. Swelling of all or part of the breast. And significant changes in breast size. It is important to get any breast changes checked out promptly by a healthcare provider. Here are some risk factors you cannot control for breast cancer, and they include your race, gender, females are at greater risk than males, genetic mutations, inherited changes or those mutations to certain genes. Females who have inherited these genetic changes are at a higher risk. And last, getting older. The risk for breast cancer increases with age, and most breast cancers are often diagnosed after age 50. Here are the risk factors you can control for breast cancer, and they include not exercising or lack of physical activity creates a higher risk. Not eating a healthy diet full of fresh fruits, vegetables, and whole grains. Studies show that a female's risk for breast cancer increases with the amount of alcohol consumed. Previous treatment using radiation therapy to the chest or breasts before age 30 increases risk of getting breast cancer later in life. If you smoke, please stop. And last, being overweight or obese after menopause increases the risk than for those females at a normal weight. In addition, some forms of hormone replacement therapy taken during menopause can raise the risk for breast cancer when taken for more than 5 years. And certain oral contraceptives, your birth control pills, also have been found to raise the risk. You can help lower your risk of breast cancer by taking care of your health in the following ways. Keep a healthy weight through a healthy diet. Exercise regularly or increase daily physical activity. Don't drink alcohol or limit alcoholic beverages. If you smoke, don't. If you are taking or have been told to take hormone replacement therapy or oral contraceptives known as birth control pills, ask your healthcare provider about the risks and find out if it is right for you. If you have children, breastfeed if possible. And last, if you have a family history of breast cancer or inherited changes in your genes, talk to your healthcare provider about other ways to lower your risk. Staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving cancer if it occurs. The United States Preventive Services Task Force is an organization made up of healthcare providers and disease experts who recommend that females who are 40 to 74 years old and are at average risk for breast cancer get a mammogram every 2 years. There are 2 screening errors that may occur. False positive test results is when a radiologist sees something that looks like cancer but is not. And mammograms may also miss some cancers called false negative test results, which may delay finding cancer and getting treatment. A mammogram is an X-ray of the breast and surrounding tissue. For many females, mammograms are the best way to find breast cancer early when it is easier to treat and before it is too big enough to feel or cause any symptoms. Regular mammograms can lower the risk of dying from breast cancer. When you have a mammogram, a radiology technician positions and compresses breast and surrounding tissue between 2 clear plates, which are attached to a highly specialized camera that takes 2 pictures of the breast from 2 directions or angles. For some females, more than 2 pictures may be needed to include as much tissue as possible. Mammography can be painful for some females, but for most it is mildly uncomfortable and the sensation lasts for just a few seconds. Compressing the breast is necessary to flatten and reduce the thickness of the breast. From start to finish, the entire procedure takes about 20 minutes. A diagnostic mammogram generally takes more time than a screening mammogram due to the need for more pictures from multiple angles. Mammography involves minimal radiation exposure and the American Cancer Society notes that the dose of radiation received during a screening mammogram is about the same amount of radiation a person gets from their natural surroundings in an average 3-month period. If you've had breast surgery for any reason, such as a benign biopsy, implants, or surgery to reduce the size of your breast, the reviewing radiologist will want to know where the scars are in case the scar tissue has to be distinguished from another kind of breast abnormality. If you've had breast surgery, the radiology technician will place small metal ball stickers on your breast to mark your scar. A couple of tips for getting a mammogram. Try not to have your mammogram the week before you get your period or during your period because, as you know, your breasts may be tender or swollen. On the day of your mammogram, don't wear deodorant, perfume, or powder because these products can show up as white spots on the X-ray. And last, just be aware that you will need to undress from your waist up for a mammogram. 3D mammograms have come a long way since their predated mammograms, which were 2D viewpoints. And 3D mammograms find more cancers than the original 2D. They reduce false positives, and they use much lower dose images using different angles. Let's define dense breast tissue. Breasts are made up of fibrous tissue, glandular tissue, which is the tissue that in females produces milk, and fatty tissue. If you have dense breasts, it means that you have more fibrous and glandular tissue and less fatty tissue. Having dense breasts is normal and it does not cause symptoms. However, dense breasts are associated with a risk of breast cancer that is up to 4 times higher than the average. This higher risk is partially because it can be hard to see cancers in mammograms of dense breasts because cancerous tissue also looks white on mammograms. For the photos on the right, fatty tissue appears dark on a mammogram and dense tissue appears white. About half of the females who have mammograms have dense breasts, and about 10% have extremely dense breasts. We don't know why some females have dense breasts and some don't, but some factors that do affect breast density include age, pregnancy and lactation, weight loss, and hormone replacement therapy. Certain types of breast cancer, such as inflammatory breast cancer, can also increase the density of the breasts. Here are 2 examples of diagnostic ultrasound screening tools that a healthcare provider may order for further screening after a mammogram. Specially trained technicians may perform handheld breast ultrasounds. A handheld breast ultrasound uses a small portable device to send high-frequency sound waves through the breast. The sound waves are converted to images on a viewing screen. Handheld ultrasound finds cancer that has not spread to the lymph nodes than mammography alone in women with dense breasts. Second, an automated breast ultrasound uses a larger machine to send high-frequency sound waves through the breast to create pictures for review. A breast MRI uses magnets and radio waves to take pictures of the breast using a contrast injection. MRI is used along with a mammogram to screen women who are at high risk for breast cancer. Breast MRIs are not used for women of average risk. So let me explain how it works. As you can see to the picture to the right, the patient lies face down on a special table, and the MRI will obtain initial images. Then a contrast agent will be injected into the vein of your arm, and the MRI will be run again to obtain additional images with the contrast. The exam takes somewhere between 25 to 45 minutes, and the MRI screening is best performed 7 to 10 days into your menstrual cycle. There are 3 common types of breast cancer in females. Breast cancer has 2 forms based on where the tumor starts in the breast tissue and whether the cancer has spread or not. In situ breast cancer starts in a milk duct and has not spread throughout the breast. Invasive breast cancer has spread into surrounding breast tissue. According to the American Cancer Society, ductal carcinoma in situ, DCIS, means the cells are cancerous but have not spread to surrounding tissue. DCIS is an early stage cancer that starts and stays within the milk duct. Nearly all females with DCIS can be cured with either breast conserving surgery or a simple mastectomy. Invasive ductal carcinomas, IDCs, start in the cells that line a milk duct in the breast. However, over time, IDCs can spread to the lymph nodes and possibly other parts of the body. Invasive lobular carcinoma, ILC, is the second most common type of invasive breast cancer, and this type starts in the milk-producing glands, the lobules, and can spread to other parts of the body. A treatment plan for breast cancer is determined by the surgeon or oncologist in partnership with the patient. Because surgery remains the primary treatment for breast cancer, one of the first decisions most females will make after a breast cancer diagnosis is the type of surgery to remove the cancer. There are many surgical options depending on a female's personal goals and preferences and the cancer itself. Because every breast cancer is different, the type of surgery will depend on these factors: the type of cancer, the location of the tumor in the breast, the size of the tumor, whether the cancer has spread, how abnormal the cells look under a microscope, whether the cancer has hormone receptors for targeted cancer drugs, whether you have gone through menopause, and whether you have been previously treated for breast cancer. Based on these factors, your healthcare provider will make recommendations about surgical options so you can make a decision that is best for you. There are 2 main types of surgery to remove breast cancer. First, lumpectomy, also known as breast conserving surgery, involves removing the part of the breast where the tumor is located, along with a border of healthy tissue surrounding the cancer to remove clean margins. The surgeon may also remove part of the chest wall lining if the cancer is near it, or remove some lymph nodes under the arm for biopsy. If the biopsy indicates the margins also have cancer, a second operation or mastectomy may be necessary. Lumpectomy may be a good choice if you have a non-invasive breast cancer or a less advanced stage of cancer. However, in most cases, women opting for lumpectomy also have radiation therapy to the breast and sometimes the underarm area. Oncoplastic reduction lumpectomy is a procedure where a larger amount of breast tissue is removed during the lumpectomy and the breast is reshaped smaller. This procedure allows the female to receive a breast reduction and the benefit of a larger lumpectomy. After the surgery, radiation therapy is indicated. Next, mastectomy is an operation to remove the entire breast and is typically done if a female has an advanced form of breast cancer, has small breasts but a big tumor in one of the breasts, or has a genetic mutation for inherited breast cancer. There are different types of mastectomy, including total simple mastectomy, which is the removal of the entire breast with the nipple and surrounding skin. Some of the lymph nodes under the arm may also be removed. A reconstruction can be done at the time of surgery. Modified radical mastectomy is the removal of the entire breast with the nipple and surrounding skin and the lymph nodes under the arm. A reconstruction can also be done at the time of this surgery. Radical mastectomy is the removal of the entire breast, the overlying skin, chest wall muscle, and the lymph nodes under the arm. But I must note, this procedure is rarely done. Nipple-sparing mastectomy involves removing the breast tissue and preserving the nipple and areola. This is done with a reconstruction procedure. And last, the double mastectomy, also known as bilateral mastectomy, is the removal of both breasts. Typically, surgeons only recommend a double mastectomy if there is cancer in both breasts, the female has inherited gene mutations, or is at higher risk of developing breast cancer for any reason. In addition to surgery, other treatment options may be used before or after surgery. Chemotherapy is the use of drugs to chemically destroy cancer cells. Chemotherapy may be one drug or a combination of drugs. Hormone therapy works by blocking or lowering the level of a determined hormone from getting to cancer cells, which the cancer needs to grow. Targeted therapy is when a therapy is focused on a specific gene or protein. These treatments attach to a specific target and block the growth and spread of cancer cells while limiting damage to healthy cells. Targeted therapies cause fewer and less severe side effects than chemotherapy. Immunotherapy is the use of drugs that target proteins on immune cells called checkpoints that need to be turned on or off to trigger an immune response against the breast cancer cells. And last, radiation therapy may be used to shrink or slow tumor growth. We have identified that in some cases, cancerous cells can invade surrounding breast tissue. If breast cancer spreads further, cancerous cells most often appear in the bones, liver, lungs, or brain. Tumors that begin at one site and then spread to other areas of the body are called metastatic cancers. In metastasis, cancer cells break away from where they first formed, which is the primary cancer, and travel through the blood or lymph system and form new tumors in other parts of the body. The most common types of breast cancer in males are the same found in females. DCIS is the finding of cancer cells only in the lining of the ducts and have not spread to other tissues of the breast. Invasive ductal carcinoma is cancer cells that have grown outside the ducts into other parts of the breast tissue. As previously shared, invasive cancer cells can also spread or metastasize to other parts of the body. Male breast cancer symptoms may include changes to the skin covering the breast, thickening of the breast tissue, nipple beginning to turn inward, dimpling of the nipple or the breast area, and the noticeability of discharge from the nipple. These symptoms can happen with other conditions that are not cancer. If you have had any of the listed symptoms that worry you, please see your healthcare provider right away. Several factors can increase a male's chance of getting breast cancer. However, having risk factors does not mean a male will get breast cancer. The risk for breast cancer increases with age. Most breast cancers are found after age 50. Inherited changes or genetic mutations in certain genes increases the risk. A male's risk is higher if a close family member has had breast cancer. Males who have had radiation therapy treatment to the chest have a higher risk. Hormone therapy treatment. Drugs containing estrogen, a hormone that helps develop and maintain female sex characteristics, which were used to treat prostate cancer in the past, increases a male's risk. Klinefelter syndrome is a rare genetic condition in which a male has an extra X chromosome. This can lead to the body making higher levels of estrogen and lower levels of androgens, which are the hormones that help develop and maintain male sex characteristics. Conditions that affect the testicles. Injury to, swelling within, or surgery to remove the testicles can increase risk. Liver disease. Cirrhosis of the liver can lower androgen levels and raise estrogen levels in males, increasing risk. Males who are overweight or are obese have a higher risk of breast cancer than males of normal weight. Risk can be lowered by keeping a healthy weight, increasing physical activity, and/or exercising regularly. Right questions when diagnosed with cancer is critical. Listed are 8 questions to consider asking upon receiving a breast cancer diagnosis. 1. What type of breast cancer and receptor status do I have? Learning more about the type of cancer and receptor status can give clarity about the diagnosis and a better understanding of the current health status as well as treatment options. 2. How is the type of treatment decided? Each person is different, and so are cancers and their characteristics. That is why treatments are individualized to the patient and targeted to the specific type of cancer. 3. Do all breast cancer patients require chemotherapy? Chemotherapy is a common treatment chosen for many cancer patients because of its aggressive nature. However, depending on the type of cancer, chemotherapy may not be recommended as part of the treatment plan. 4. How will my cancer and treatment plan affect my quality of life? Cancer and cancer treatments can disrupt many aspects of life. It is important to share concerns with the oncologist throughout the cancer journey, from the start of the diagnosis to post-treatment. 5. Will I be able to continue working or take care of my family while undergoing treatment? While many cancer patients find treatments lead to nausea, fatigue, and weakness, each patient experiences treatments differently. Discussing with the oncologist the symptoms and side effects of the cancer diagnosis and associated treatments helps patients determine what is to be expected, allowing them to make needed adjustments in their day-to-day routine, whether that is at work or at home. 6. Will I need to make any nutritional changes? Eating well and ensuring proper nutrition is maintained plays an important role in a patient's cancer journey and recovery, which is why a dietitian is often part of the care team. 7. How do I tell my children I have breast cancer? Sharing news is difficult and emotionally taxing. Patients should share their diagnosis with children when they are ready and have received accurate information. And last, number 8, are there support groups available to help patients and their families? Having support throughout the cancer journey is important because cancer can take a toll mentally, physically, and emotionally. Support systems have been shown to positively influence cancer outcomes, and patients should establish their support systems early on. Start with creating a support group of family and friends, and then connect with local and national groups, such as those provided by the American Cancer Society, to find additional resources. Take-home message. Breast cancer affects both females and males. Females should consider routine screening mammograms by the age of 40 or sooner if recommended by a healthcare provider. Both females and males have similar signs and symptoms that should not be ignored. Choose positive lifestyle choices to reduce your risk for breast cancer. And always ask questions of your healthcare provider to ensure you are fully informed about your diagnosis and the multiple treatment options that you can consider. SummaCare resources. We encourage that you have an annual visit with your primary care provider. We offer condition management and care management programs, which provides guidance if you're diagnosed with a chronic condition or have complex needs. We provide access to diabetic testing supplies. We offer telephonic health coaching for lifestyle behavior management. Through Plan Central, you have access to WebMD Health Manager for various educational components. You have access to a 24-hour nurse line where you can speak to a SummaCare nurse 24/7, 365 for any of your medical questions or needs. You have access to Teladoc Health, which is a telemedicine feature while traveling or in need for minor medical issues or concerns. We do offer a quick care smoking cessation telephonic coaching program that also provides limited nicotine replacement therapy. And you have access to discounted health club memberships, nutrition programs, and educational resources through our HUSK Health and Wellness Discount Program. Thank you for joining and listening in on this presentation. Here are the resources that I used to create this presentation. And as always, follow SummaCare on any of the listed below social media platforms. Thank you for your time and be well.